Continuing medical education, CME. Importance of ongoing education in reproductive medicine. Continuing medical education, CME, plays a crucial role in ensuring that healthcare providers, including reproductive medicine specialists, maintain and enhance their knowledge and skills throughout their careers. In the field of reproductive medicine, which is constantly evolving with new technologies, treatments, and research, CME helps specialists stay up to date with the latest advancements and best practices in patient care. This is particularly important in fields like reproductive endocrinology, infertility treatments, and assisted reproductive technologies, ART, where innovation and evolving clinical guidelines are common. 1. What is continuing medical education, CME? Continuing medical education, CME, refers to educational activities that medical professionals engage in to maintain, enhance, or increase their knowledge, skills, and competencies in the practice of medicine. CME is typically required for licensure, certification, and recertification by medical boards and organizations. It helps ensure that healthcare professionals remain proficient in their field and provide the highest quality care to their patients. CME requirements. License renewal. In most countries, CME is required for physicians to maintain their medical licenses. For example, the American Medical Association, AMA, requires licensed doctors in the US to complete a certain number of CME credits over a specified period. Board certification. For specialists in reproductive medicine, such as reproductive endocrinologists, CME is a key component of maintaining board certification. Organizations like the American Board of Obstetrics and Gynecology, ABOG, require physicians to complete CME credits as part of the Maintenance of Certification MOC process. Voluntary versus mandatory. Some CME is voluntary, allowing healthcare providers to choose specific topics that align with their practice or interests, while other CME is mandatory, particularly for certification and recertification purposes. 2. Importance of CME in reproductive medicine. Reproductive medicine encompasses a wide range of specialties, including infertility, fertility preservation, ART, in vitro fertilization, AVF, egg and sperm donation, reproductive endocrinology, and genetics. Each of these areas is highly dynamic, with continuous advancements and evolving clinical practices. CME helps reproductive medicine specialists stay current with evolving treatments and technologies, innovations in art, advancements in art techniques such as genetic screening, PGT, egg freezing, embryo freezing, and improvements in IVF protocols require ongoing education for reproductive endocrinologists. CME courses help specialists stay informed about the latest ART methods and technologies. New fertility medications. The development of new pharmacological treatments for fertility, such as more targeted hormonal therapies and medications that improve the success rates of IVF, also necessitates CME to keep practitioners up to date. Advances in genetics. As genetic testing becomes more integrated into reproductive medicine, e.g., genetic screening of embryos, staying updated through CME courses in genetics is crucial for specialists to provide accurate counseling and treatment options. B. Improving patient outcomes. Quality of care. CME contributes to improving the quality of care provided by reproductive specialists. By staying informed about the most recent guidelines, clinical trials, and case studies, physicians can better diagnose and treat infertility, reduce complications, and improve patient outcomes. Personalized treatment plans. Reproductive medicine increasingly emphasizes personalized care, which includes considering a patient's genetic, hormonal, and psychological factors. CME programs help providers understand how to tailor fertility treatments to individual patient needs. Emerging issues in reproductive health. Issues such as male infertility, recurrent pregnancy loss, and endometriosis are complex and may require updated knowledge for effective management. CME offers opportunities to learn about the latest research and treatment approaches for these conditions. C. Regulatory and ethical updates. Regulations in ART. The legal and ethical landscape for ART procedures is constantly changing, with new regulations and ethical considerations emerging regarding practices such as egg freezing, genetic screening, and surrogacy. CME helps reproductive specialists stay informed about local, national, and international regulations. Ethical standards. CME ensures that specialists in reproductive medicine are aware of ethical issues surrounding ART, such as embryo selection, genetic manipulation, and ethical dilemmas in surrogacy. Keeping up to date on these topics is critical to providing ethically sound care and following legal frameworks. 3. Methods of CME in reproductive medicine. There are various formats for CME that allow reproductive medicine specialists to continue their education and stay current with the latest trends and developments in the field. A. Conferences and workshops. Annual conferences. Reproductive medicine specialists often attend national and international conferences, such as those organized by the American Society for Reproductive Medicine, ASRM, the European Society of Human Reproduction and Embryology, ESHRE, and the Society for Reproductive Endocrinology and Infertility, SREI. These conferences feature keynote speakers, expert panels, workshops, and discussions on the latest research and treatment protocols in reproductive medicine. Workshops. Focused workshops are often available during conferences and as standalone events. These workshops typically focus on specific areas of reproductive medicine, such as improving IVF success rates, new techniques in embryo cryopreservation, or innovations in fertility medications. B. Online courses and webinars. Online CME programs. Many organizations offer online CME programs and webinars that allow reproductive specialists to earn credits from the comfort of their homes or offices. Online courses may cover a wide range of topics, such as new ART techniques, advances in male infertility treatment, or ethical considerations in genetic testing. Interactive webinars. These live online sessions often involve interactive discussions, Q&A, and case studies, allowing specialists to engage with experts in the field. This format is particularly valuable for specialists who are unable to attend in-person events. C. Journals and publications. Peer-reviewed journals. Reading articles in peer-reviewed journals like Fertility and Sterility, Human Reproduction, or Journal of Assisted Reproduction and Genetics is a critical method for keeping up to date with the latest research findings and clinical practices. Many journals offer CME credits for reviewing articles, or completing quizzes based on the material. Research publications. Continuing education through reading recent studies or clinical trials in reproductive medicine helps practitioners stay informed about the latest evidence and emerging therapies. D. Case-based learning. Case reports and case studies. CME programs often use real-world case studies to challenge specialists to apply their knowledge to practical scenarios. By reviewing challenging cases in reproductive medicine, specialists can better understand how to handle complex situations and make informed decisions. 4. Benefits of CME in reproductive medicine. CME offers multiple benefits to reproductive specialists, patients, and the healthcare system as a whole. A. Enhanced professional development. Continuous learning helps reproductive specialists maintain a high level of expertise, improving their career prospects and allowing them to offer the best care to their patients. B. Better patient care and safety. By keeping up to date with the latest evidence, guidelines, and treatment options, reproductive endocrinologists can provide safer, more effective treatments, leading to better patient outcomes and satisfaction. C. Improved clinical competence. CME programs help specialists improve their clinical competence in areas such as diagnosis, treatment planning, patient communication, and managing RT procedures, resulting in more precise and individualized care. D. Contribution to research and advancements. Many CME programs involve a research component, which helps specialists contribute to the academic community by participating in clinical studies or publishing findings. This drives innovation and ensures that the field continues to evolve and improve. 5. Conclusion. CME is essential for reproductive medicine specialists to ensure that they provide the highest standard of care. With rapidly changing technologies, treatment methods, and regulatory frameworks in reproductive health, ongoing education is crucial. By participating in CME, reproductive endocrinologists and fertility specialists can enhance their knowledge, improve patient outcomes, and stay at the forefront of the latest advancements in ART and reproductive medicine. CME ensures that reproductive specialists are well equipped to handle complex infertility issues, provide individualized treatments, and make informed clinical decisions that benefit patients in their reproductive health journeys.